So this first slide, everyone, is an overview of the project. It's an architectural rendering, and it shows the layout of all the buildings. You can see down on the right-hand side is the housing area where the homes will be built. This left side, we have the EMS building. Moving up the picture, we have the public health building, the two-story main hospital with a helipad in the back, and then moving around the dental building, and then there's a space in between those two buildings for a future dialysis building, and then at the very top, the behavioral health building. Here's a quick slide showing the square footage of the different buildings, and the total square footage of the project is just under 180,000 square feet. The main hospital at almost at 140,000 square feet, and the other buildings there. Here is a current overhead aerial photo of where we are at the project right now. It was just taken back in April. You can see the staff quarters down below and all the buildings, how similar it is to that architectural rendering, the first slide we looked at. Here's another slide of the current construction. This is the north side of the project, looking south. We're right over the ambulance drop-off at the emergency department. You can see on the left side is the big main grand entrance with the porte-cochere drop-off. Here's an overview of the first floor of the main hospital, outlining the different departments. On the right side, you have the main entrance, where you come into a reception area, where you would wait to get placed into one of the 30 primary care or specialty care rooms. Once you're in that room, there's a central core of doctors, where the doctors will come from room to room to see you in your own treatment room. Down along the bottom there's some specialty care areas. The pharmacy is in the corner, podiatry and audiology. There's a physical therapy department. Then moving up, you have your eye care, your lab, and then up at the top, you have diagnostic and imaging, where they have 2 general radiology rooms and a CAT scan. And there's also room for a mobile MRI to be parked on the back side of the imaging area. Just to the right of that is the emergency department, and not shown on this slide, but right above that is a helipad, so they have direct access into the emergency department. There are 2 elevators on the project, 3 stairways to the second floor. The large area in the corner up at the right is the administration department. And then here, this is the second floor of the main hospital. The big important part of this floor is the labor and delivery area. There's 2 labor and delivery rooms with a nursery in between, so that birthing can take place right on the reservation. Next to that, there are 2 ambulatory procedure rooms, and on the north side, you have 8 inpatient beds with all private rooms. With their own shower and bathroom, and there is design for future expansion for more patient rooms. Here's a photo of the current construction of the public health building, and here's the layout of the public health building. This building will house diabetes prevention with a demo kitchen where you can do meal planning. It also houses public health, women and children's health, and then the IHS departments are also housed in this building. Next, we have the dental building. The dental building has 20 dental chairs, 6 closed procedure rooms, and it has its own administration department and conference room. And then lastly, we have the behavioral health building. The behavioral health building has 10 counseling rooms around the sides. Each counseling room has its own outdoor patio, and then in the corner there's a large group therapy room. Here we have the EMS building. The EMS building was completed early. It's where we house our offices for construction. It has 4 ambulance bays, 2 living quarters rooms, a small kitchenette area for the on-site staff that will be housed in that building. Here's a quick slide of the construction costs. As Hardy mentioned, total project value is $116 million. The construction costs are about $80 million of that. and the rest makes up the equipment, the imaging equipment, the x-rays, the CAT scan, all the furniture. You can see how that breaks down there. This slide just kind of takes you back in time to show where we've came. This is the loop road that we built to the project, where we widened the highway, and we built the water facility to provide backup water to the hospital. Here's another picture of the EMS building. One of the reasons to build this building early was to house our offices, but it also gives us a chance to see how all the materials come together and how all the details work together, so when we build the rest of the buildings, we know how everything's going to work. And here's some pictures of the interior of the EMS building. The top left picture, you can see it has high-end ceramic tiles, stone, glass, wood ceilings, very high-end materials. Here's some more current construction photos. The top left picture is of the stonework at the main entrance. The picture on the right there is the emergency generators that were just set on site. The facility will be powered if there's a power outage by 3 large emergency generators. And then we have a couple other pictures of the framing and stonework going on. A few more pictures. The top right picture is the central plant. That's the pumps. That's where all the facility is powered. All the water is distributed to the different buildings. And then we have some framing and exterior photos. Just a look back at the schedule, we started the offsite water facility. Then we started the site structure and EMS building, the hospital slabs and exterior, and then the outbuilding, public health, dental, and behavioral building exteriors. And the portion of work we're in right now is the interiors and the site finishes, and then after that we will start the staff quarters portion of the project. Once construction is completed, the tribe will work with IHS and go through the furniture and equipment move-in. There's medical cleaning that needs to take place before patients can be seen, and then the hospital staff will do dry runs and training so they know the layout of the building, and then the tribe will get all the medical inspections completed at that time as well. And then just to follow, here's just a slide of the overall of the site.